Good evening, everyone. Thank you very much for joining us on this Friday evening for our webinar. We are going to focus primarily on egg freezing for this evening, but we're going to discuss how we do it in the current pandemic. So I'd like to introduce this evening's panel. We have Dr. Geetha Venkat, who will be covering most of the clinical and medical side of things. Unfortunately, I'm sending apologies on behalf of Rachel, who's our lead nurse, because she couldn't make it due to unforeseen circumstances. But we also do have Carina, who's one of our patient coordinators on the panel as well, and myself. So the agenda for this evening's webinar is, to start with, we're going to discuss the checkup, because before you can think about freezing your eggs, we need to try and determine what your fertility status is. And after that, we can say, okay, once we've looked at your fertility status, we will look at egg freezing and what the treatment involves and what the outlook might look like. And then we'll go into the actual sort of egg freezing pathway, so what you would expect if you were to actually go through this treatment, and then some initial practical steps. I'm going to hand over to Dr. Venkat, who will go through the checkup and the freezing.
Hello everybody. Good evening, and thank you, Suvir. So first of all, like Suvir mentioned, to know about your body and the eggs and the ovarian reserve, so we do a basic fertility checkup, and this involves an ultrasound scan and blood test to check your hormones. Of course, if the partner is involved, then the sperm analysis, but here mainly the ovarian reserve. And here this picture shows, it's the diagram of the uterus and the ovary. So in the scan, we look at your uterus as a general observation, and then look at the ovaries particularly to see if there is any cyst or endometriosis which can cause problem, and the number of eggs. You can see some baby follicles which will give us information about the number of eggs. The hormone profile will include AMH, which gives us information about the number of eggs, and other hormones like FSH, LH, which will give us information regarding the ovarian function. So the idea being, we assess the ovarian reserve by the ultrasound scan as well as by the blood test. And we'll have a conclusion to say whether the ovarian reserve is good or average or poor. That's what we try to analyze. Okay, so how do we do that? As I told you, we will arrange an ultrasound scan, and it is done between the 2nd day and 5th day. What does it mean? When you start your period, that is called day 1. And everybody has a doubt, which is my real day 1, doctor? Because I start spotting for a day or 2, then the proper flow starts. So we always say day 1 is the day of the proper flow, proper bleeding. So you call the clinic on the day 1 or the first day of the period, and we book the scan and blood test between the 2nd and 5th day. And like I said, we visualize the ovaries to check the number of eggs, and then blood test to check all these hormones which are involved in the reproduction. You might be wondering why we are checking thyroid, vitamin D, and all these things, because they are involved and related to the ovulation, as well as really if you are deficient in thyroid or prolactin or vitamin D, this can cause miscarriage. That's why we check these things. Okay, so when is the good time to have a checkup? We say, oh, you know, up to 35, everything is all right. I don't need a checkup. No, don't leave it too late. And also, every person is different. Every 30-year-old woman is not the same. Somebody's ovarian reserve may be very good at the age of 30, and another person's ovarian reserve may be very low. We are shocked to see some people's ovarian reserve being 1 and 2 at the age of 30, 31, 32. This is not very common, but we do see it. Therefore, don't leave the testing till late. It's better to get yourself checked in your 20s and make a plan as to what you are going to do. And if this is more important, if there is a family history of premature ovarian failure, like if mother had early menopause or grandmother had early menopause or one of the maternal aunts, So it's important that you get yourself checked. And I know sometimes people get the FSH done alone, thinking that if it is normal, everything is normal. It is not. FSH may be normal for a long time, even after your egg number has started going down. Therefore, the important test is anti-Mullerian hormone. It's called AMH. And if the AMH is less than 5, we call it very low ovarian reserve. Normal range is between 10 to 20. And supposing your ovarian reserve is somewhere around 10, and you think, oh, it is all right, I don't need to do anything. If you are going to leave things to a later date, then it's better to get your AMH checked every 6 months to see when it starts going down suddenly, because otherwise you will miss that. And then suddenly when you check again after 2 years, it might be very low. Therefore, it's better to check it every 6 months to assess. And if you are having a borderline level, or if you are going to delay, you are starting your family, it's better to think about egg freezing. Okay, so egg freezing, as I said, that look, it doesn't mean that you are only going to use those eggs and have a baby from that. What we say is, look, you don't know when you are going to start your family. Women are now, they are sort of doing the jobs, they want to progress in their career, they are ambitious very professionally, they want to come to decent level and then meet Mr. Right and settle in family life financially and have a house so that the child can grow up in a nice area. All these things we plan, and therefore if you are going to do all these things, have a family later, better to freeze the eggs. And then once you decided to start a family, and try naturally first. If it doesn't happen, then you have the backup of the frozen eggs. Okay. However, I want to tell you that there is no guarantee that you will definitely have a baby from frozen eggs, because it depends on the quality of the eggs and how many eggs you freeze and what age you freeze. Because with age, the quality goes down. You might have the number, but if the quality goes down, then it's difficult to make a baby with that. That's why we say we can't give you any guarantee. And if you ask me how many you should have, at least you aim to freeze something like 30 eggs. That will give you a reasonable chance of having a baby. The next point I would like to mention is that you can keep the eggs frozen up to 10 years. Supposing a woman freezes the eggs at the age of 30, and then it finishes by the age of 40, then you'll say, look, I'm still not ready to have a baby, but then my eggs will expire. What will I do? You can get it extended under certain circumstances. If there is an imminent risk of having premature ovarian failure or premature infertility, then you see the clinician. Clinician can sign the form in support of your extending the freezing eggs, frozen eggs. Therefore, you will be able to extend the storage period under these circumstances. And again, technically, I would like to say that why egg freezing has become more and more popular these days, not before. See, when I started my career doing IVF, we never heard of egg freezing. And slowly it started later, say 10 years ago. At that stage, we were freezing the eggs by what is called slow method. And it didn't have a good success rate. Say if we froze 10 eggs, only 1 or 2 will survive. That was no good. Therefore, we didn't recommend it as a viable method at that time. Now the technique has changed. We freeze by a new method called vitrification. It's called rapid freezing. This has got a better survival rate. So supposing we freeze 10 eggs, we are able to retrieve something like 8 to 9 eggs, which is very good. And then we fertilize those eggs and we are able to make a baby out of those eggs. Whereas the previous method was not successful, but this new technique is much more practical and helpful. It becomes a good option for women who want to delay the term, having the family. Right. So then once you decide that you want to do something about this and you want to freeze your eggs, then you must be wondering, oh, I don't know how long it will be and what are the things, how do I proceed? So all you need to do is to approach the fertility clinic. They will do the fertility assessment first. And then the whole process of the treatment, it takes about 2.5 weeks, 2 to 2.5 weeks. And it involves hormone injections and tablets. to grow the eggs, and then we collect the eggs under anesthesia because people are frightened. They'll think, oh my God, it's going to be painful. You won't feel any pain because it's done under anesthesia. We take the eggs and we freeze the eggs. Remember, we cannot freeze all the eggs. We can freeze only mature eggs. And the other point I would like to mention here is when we take the eggs out, these frozen eggs cannot be fertilized with IVF technique. They have to be injected with the sperm, and then the fertilization occurs. And like I mentioned before, we aim to get something like 30 eggs to be frozen to give you a realistic chance of having a baby. Now we are going to talk about the pathway, egg freezing pathway. Now you will be thinking, where do I start? How do I do it? So you phone the clinic, make an appointment for an initial consultation. Nowadays, the COVID-19 has helped us in some ways. You can do the consultation sitting at home. You don't need to travel to the clinic. It's safer for you and also less time consuming. And so the consultation happens on video, that is Zoom or Skype, with the consultant. The person goes through everything with you, takes your medical history to see if there's any other extra risk of you are having early menopause or any issue or low ovarian reserve, and discusses all the treatments and arrange the fertility assessment. After that, plan your treatment. And when you come for this, see, these are the initial tests we talked about. Then we discuss the follow-up consultation is to plan your treatment. That is to say, the doctor will say, look, if your period started on this day, we'll give you some tablets so that we prepare you for the treatment. Then with your next period, after the period, we start the hormone injections for 10 to 12 days. These injections can be administered by the individual. These are subcutaneous injections, just like diabetic pen. So these are very simple. You can do it yourself. But I know there are some women who are frightened of needles, and then they can ask one of their friends to inject or partner to inject if they have a partner, or somebody in their family can help them. So they do that, and that is what is done in the nurse's consultation. The nurse will go through how to do the injection. They will show in the video, teach in the video how to do the injection. They will also do a consultation regarding the signing of the consent forms, because now remember, eggs are your property. The clinician cannot do anything, or the embryologist cannot do anything with your eggs. So you have to tell us what we should do. You say you want to freeze your eggs only for 5 years. That is your choice. You have to mention in the consent form. Or if you say you want them frozen for 10 years, you have to say that. Or if something happens to you, for example, in an accident, you die or something, what would you like us to do with your eggs? So these are the questions they will ask in the consent form. The nurse will explain to you and then ask you to make a choice and complete the consent form. Once you have done the paperwork, screening tests and everything, when I say screening test, what it means is we also do blood tests to check for any infection before we freeze your eggs, like HIV, hepatitis B, etc. These all are done in one single visit. And then we start the stimulation with the period, like it is demonstrated here, one injection and one tablet, that is every day one tablet. And when you are doing this, you have ultrasound scan and blood tests at regular intervals to see how you are responding to the stimulation. If it is going well, then we keep the same dose. If its sort of response is not so good, we might increase the dose. Or if somebody is over-responding, leading to hyperstimulation, then we have to reduce the dose. That is the dose, the job of the clinician and the nurse to monitor you, to make sure you don't hyperstimulate and produce a decent response. Not too many eggs, not too few eggs either. So we have to get the balance right. Once it's all ready, the follicles are mature, we give you what is called a trigger injection. This is very important, I tell you, because this has to be given at certain time, 36 hours before the egg collection procedure. Supposing the egg collection is at 10 o'clock on Wednesday, this has to be given at 10 o'clock in the night on Monday evening. So that timing is important. I know some people, due to nervousness, they have dropped the injection. And I can tell you, I have got so many phone calls And I had to rush to the clinic to give them another trigger injection because they have dropped it. These things have happened. But this trigger is injection because if you don't have this injection, the eggs will not come out, whatever it may be. So that's why this injection is very important. And this is a very tiny diagram explaining how the collection is done. It's done under ultrasound guidance with the ultrasound probe. And then you see the enlarged ovaries. The needle goes through the vagina into the ovaries, and then we collect the eggs. And of course, the tube with the aspirate, but the fluid is given to the embryologist. They identify the egg, keep all the eggs together, and then they freeze the eggs together and put it in the tank where they store it. So egg storage. Then what we do is, so the time frame, we want to say first checkup 1 week, and then the treatment is 2 to 2.5 weeks. So it doesn't take long. Okay, so practical step. It is my job to make it simple. That's why we have simplified it like this. You can see. So get a checkup first and know your fertility status or ovarian reserve. Then once you have this in your hand, then think about the future. I always say, look, sometimes we can't. It's difficult to plan the whole thing in your life. So there are some uncertainties. You don't know what is going to happen when you will meet Mr. Right. Therefore, if you want to have an insurance policy, then it's important to consider freezing eggs. We have done it for so many people, and we are here. We are happy to talk to you about it. And if you have any doubt or any questions, feel free to ask us. Thank you. And I'm going to hand over to Carina. She's waiting. I think I've taken too much time as usual. And Carina, over to you.
Hi everyone, I hope you're all doing well. My name is Carina, I'm one of the patient coordinators. I guess the message I kind of want to leave with you is if you're feeling indecisive about egg freezing, my advice is take it step by step. Start with having a fertility checkup, finding out more about your fertility status and discussing the option with a consultant. If you're monitoring your fertility status, it means that you're able to successfully think and plan for the future. And as Dr. Venkat mentioned earlier, egg freezing is a great, it's a great Plan B option, and it's definitely something we recommend that you think about and consider. Finally, I just want to say, if you have any queries or if you want to have a further chat about anything, please do get in touch with us. We are here to help you. And I always, whenever I speak to patients on the phone, I always explain if I don't have the answer there and then, I will always find out and get back to you. So if you have any questions at all, please do get in touch with us, and we're here to help you as much as we can. And now I think we have a short patient video we'd like to show you next. Thank you.
Our family.
I was diagnosed at 17 with endometriosis, and ever since then I've had multiple surgeries to remove the endo and to just basically keep on top of my pain management and things like that, really. When I was 20, I asked my gynecologist at the time at Chelsea and Westminster if he would think it recommended egg freezing, if I would need to kind of freeze them. And he basically, in the nicest way possible, laughed at me and said, "You're too young. We would never do any IVF treatment on you because you're 20. You've got plenty of time. You're totally fine. Don't worry about it." So that was kind of like, oh, okay. And then I basically asked my dad if we could go and see somebody who, had a better understanding. And I basically just typed into Google the best fertility doctor in London, and Dr. Venkat came up. So I begged my dad for a consultation appointment, And he said, yeah, sure, we'll go, we'll see what she says, and we'll just play it by ear. And then I met up with Dr. Venkat, and that's basically when the journey started, really, when I was 21, really.
Our family. Our family.
We did all of the tests, and unfortunately it came back that I had an AMH of 6.4, which isn't too bad, but for a 21-year-old, it's quite low. So Dr. Venkat did say that I was heading in the direction of being prematurely infertile, even though I was so young. So in 2016, around March time, was the first time we kind of sat down with Dr. Venkat and we went through everything that I would need to do to get the best chance of the eggs being really good. And because I'm single as well, we decided to get a sperm donor. So I got a sperm donor from London Sperm Bank. The first cycle we did was embryo freezing, and then I actually did another cycle 2 months after that with just egg freezing. So I had an option if I was to meet somebody in the future. I had that option to use those eggs with the person if I ever met anybody. 7 eggs and then 5 fertilized. So then we froze all of them. So we froze 5, and then the second round of just egg collection, we got 4 eggs. So that was just the first stage of it, really. We kept those in the freezer and it was great. And in 2018, I had my last surgery, my last laparoscopy with my gynecologist at Chelsea Westminster, and he basically said, your endo's too severe now. It's now in different places of your body as well. It's just not worth us every single year, maybe even twice a year, going in and removing it. The next operation I'll be giving you is a hysterectomy. So obviously that was quite, major news. And then he knew about my IVF, but he knew about my egg retrieval and that I have embryos and things like that. So he recommended that I go and start the IVF process. So that was in 2018. And yeah, so then from 2018, Harley Street Fertility Clinic was basically my second home. And to be honest, it was the best experience I could have had with such a negative experience. Do you know what I mean? Like, obviously IVF and infertility isn't pleasurable, it's not fun, it's heart wrenching at times, but when you have an amazing clinic and doctors, nurses, and even like the reception stuff, it really helps the process go that extra little bit smoother, and you feel that extra little bit of love, support.
Our family. Our family.
Right. I think that video really says it all. We're happy to take any questions that you may have. You can send them through the questions box on your panel. I think we have an audience that's been stunned into silence. Right, here we go. So the first question we have is, please can you talk about the process of retrieving the eggs? So since this is a clinical one, I'll hand this over to Dr. Venkat, please, to answer.
Everybody is so frightened of that procedure and always think, oh, it's going to be so painful. I don't want to have pain. I don't want to do this, whatever it may be. But actually, it's not a painful procedure. I'm not saying it because I'm the one who's doing it, but I really say that because you will be given anesthesia. We have an anesthetist coming to the clinic, and they will talk to you first, explain how they will give anesthesia and what they will do and what you will feel and what you will not feel. Because when they put the cannula in, you will feel everything. Then once they give the medication, you will go to deep sleep. You will not feel anything. The whole procedure takes about 15 to 20 minutes. What I usually do is put the ultrasound scan probe into the vagina, and the needle is attached to that, and it goes through the vagina, like I showed in the diagram, into the ovary, because ovary is enlarged and it is so close to the vagina. So all we need to do is just go through the vaginal wall and into the ovary. We don't go through the uterus or anything. We don't touch any other structures. And we go into the follicle and aspirate or suck the fluid in the follicle, which should usually give the egg. Sometimes it doesn't come in the first aspirate. So we flush some media, or the culture media, into the follicle and suck it out again. Then we should get the egg. It's like rinsing it out, and then we get the egg. So we go into all the follicles on that ovary, take the needle out, go to the other side, left side, and do the same thing. The whole procedure takes 15 to 20 minutes, and then you will be brought to recovery and you will be monitored for an hour. Make sure your pulse, blood pressure, oxygen saturation, everything is maintaining. And then you'll coming around, they'll ask you how much pain. If you have some pain, they'll give you extra painkillers, and make sure you have no pain. And then once you have recovered well, we make sure you're able to pass urine. We give you some tea and biscuits, and then we allow you to go home. We always say, please bring somebody with you so that they can take you home, because you have had anesthesia. That means it's not safe for that person to go home on her own. Therefore, we always advise you to bring an escort for you to go home with. So that's how the whole procedure is done. It's not painful. You might have some sore tummy after that procedure the next 24 hours, and day by day the pain will go down and it will become normal. You will have a period in 7 to 10 days. Everything will be back to normal. Okay, Suvir?
Yes, thank you very much. We haven't got any other questions, but I guess it's, it'd be good for us to discuss any of the risks that go with egg freezing. And people are always worried, questions we often get asked are, will it affect my fertility afterwards? And what are the risks of the actual treatment? So Dr. Venkat, if you wouldn't mind answering those two, please.
Yes, that's an important question as well, because first thing, as I said, is when we are doing the ovarian stimulation in young women, the first risk is overstimulation, or ovarian hyperstimulation is called. In short, it is known as OHSS. That's the term all the clinical people will use. And what it means is that when we are having the stimulation, your ovaries respond by producing lots of follicles and many eggs. So you might produce 20 eggs or 25 eggs, 30 eggs. Yesterday, I collected 35 eggs in a woman because she had polycystic ovaries. So such women tend to produce a lot of eggs, even though we gave her a small dose. So that can lead to ovarian hyperstimulation syndrome. That's why we try to reduce the dose. So this is one of the commonest. We try to be careful and bring them for a checkup after 2 or 3 days to make sure they are recovering well. And we try to reduce this complication by reducing the dose of the hormone injection so that it doesn't go over the top and make you produce too many eggs. So that's one of the complications. And after the egg collection, because the needle has gone through the vagina, there is a little bit of spotting which can last up to 24 hours. Then it settles down. And as the needle is going into the pelvic cavity, there is a possibility of infection. Therefore, we routinely give an antibiotic at the time of the egg collection to prevent any infection occurring because of this procedure. And again, after this, women will have a period, usually 10 to 12 days after the procedure. And that period can be heavier than usual. Because of the hormone stimulation, instead of producing one egg, your ovaries have produced so many eggs, and therefore the period can be heavier than usual. But that will be the only period which will be heavier and little more painful. But the next period, it will be normal, and then everything goes back to normal. These are the immediate risks of the treatment. Whereas, what are the long-term risks? Like Suvir mentioned, will it affect your future fertility? Because a lot of people ask me when they come for consultation, oh, you are planning to take out 20 eggs. Will I go through, will I lose all the eggs? Then I will not be able to conceive naturally because I have lost the eggs. It is not. Every month, something like 10 to 15 eggs come to the surface, and one of them will grow and release the egg, that is ovulation. So all the other eggs which started growing will die off. Therefore, anyway, every month you are losing so many eggs. We are taking those eggs out. We are not taking out extra eggs. Therefore, it will not affect your future fertility. It will not affect your menopause. And people have done research to find out whether this ovarian stimulation has any effect on ovarian cancer or any other cancer. They found that there is no increased risk of any cancer because of this procedure, which is all reassuring to know. Otherwise, they shouldn't be doing this, but there is no risk involved because of this.
Excellent. Thank you very much. The next question that we have asks, do you have to go on a certain diet or refrain from drinking alcohol and so on during the treatment before the extraction process?
Actually, yes, that is not so important because it takes about 90 days to make your eggs. So what you did 2 months ago is also important. It's not that that month you stop drinking, stop smoking, everything will be fine. It is not like that. So your ovaries start making the egg 3 months before. So if you have been using recreational drugs and having a very nice time, enjoying life, doing everything 3 months ago, then your egg quality may not be good. So generally, I would say, look, you should start doing it for 2 to 3 months before. But if you get so stressed and you want to have a glass of wine while you are doing the treatment, that is not going to matter so much. But generally what you eat and what your lifestyle is. So if you prepare yourself for that plan 2 to 3 months before the treatment, that is really very helpful. And one of the important things I would say is smoking. Smoking really kills the eggs. Therefore, one must be careful. If you want to have good quality eggs and good number of eggs, smoking should be stopped, especially in young girls, so that they can have viable eggs which are of good quality for freezing. And so changing lifestyle in that cycle is not so important, but before that is important. It is the general thing like smoking and not too much of drinking and eating a lot of vegetables and fruits, whatever you don't like in life, generally. So they are all good for your body, so do those things. And exercise is also important because the blood circulation should be going. Otherwise, if you are just sitting and lying down, then there is stagnation in blood supply. The toxins do not get out of the system, so which is not helpful for the quality of the eggs. That's why it's important to do some active exercises to encourage circulation. So these are all the general things to make your sort of egg quality better.
You don't have to run a marathon. You don't have to be able to run a marathon before you consider this. We'd just like you to be in good shape. The next question that we have, it says, once you decide to use the frozen eggs in due course, what's the process of fertilization in the laboratory and how does that work?
So we mentioned that the
Dr. Venkat, if I can ask you to answer.
Sorry, I started answering before you asked me. I just wanted to say the process involved is called ICSI, or intracytoplasmic sperm injection. If we just leave the sperm and the frozen egg together, the sperm will not be able to get in and fertilize the egg. So we have to inject the sperm into the egg. That procedure is called ICSI procedure, and the eggs will be fertilized, converted into embryos. We grow the embryos up to 5th day, then it's called blastocyst, and we select the best blastocyst and put it back in the uterus to make a baby. And that's how it's done. And if you have more blastocysts which are of good quality at that stage, we can freeze them as blastocysts for you to use at a later date or in future. If you have a baby from this, it's fine. If it is not successful, you can use those embryos. Or even if you have a baby, you can come and have a second baby later on. And the preparation for yourself to put this embryo back in is having some tablets to prepare the lining of the womb. It's very simple. And it takes about 2 weeks to prepare the lining of the womb. And then we fertilize the eggs, make them into embryos, grow the embryos, put the embryo back in. It's not so, it's a simple treatment. It's not so difficult like the initial stage when you have to have the injection. So you do the hard bit in the initial stages. Second part is always easier. It's not so difficult. But it's more anxious because you want to get pregnant.
The next question that we have is, what is the limit, or what is the age limit you would recommend to go through this procedure? Is it still possible to undergo this in your late 30s, or is there an age limit?
Well, there is no age limit because I have had some patients in our clinic coming to freeze the eggs in their 40s also. We don't say no, so we have frozen because they left it too late and they wanted to do it. At least something is better than nothing. Ideal age to freeze the eggs is in 20s because that is the peak of the fertility. That is the time when you have maximum number of eggs, and the quality is the best at that time, because there's no point in freezing eggs where the quality is not good, because that's not going to give you a baby. That's why freezing the eggs at the age of 43, 45 is no good, because the quality will be so poor. What I mean by that is the eggs will have chromosomal abnormalities, and then when we fertilize the eggs, the embryos will have abnormalities, and then when you have the embryo transfer, you will have a miscarriage. You will not get a healthy baby out of this. That's why we say it's important to freeze the eggs when the egg quality is better. So the quality is much better when someone is young. The younger you are, the better is the quality. Therefore, in the early 20s or 30s is the best time to freeze the eggs. However, if someone was not aware of it at that age and come to realize it in their late 30s, still not late to do it, but it's not the ideal scenario. It's the choice is yours, but if you want to do something, even at that late stage, better to freeze some eggs, better than not doing anything.
So we have one last question, which I can field myself. It says, is there a referral discount? I believe we're offering 10% off a checkup if you have attended this webinar. So please follow up with Carina in due course, and she'll be able to take care of that for you. So unless there are any other pressing questions, which I don't see, all that remains is for me to thank this evening's panel. So thank you, Dr. Venkat. Oh, we've had one sort of last minute question come in, which is, how much does the whole process cost approximately, all the way from consultation all the way to freezing and any ongoing costs? So I can probably actually field this myself. So the checkup process costs about £350, and a round of egg freezing, so the treatment costs about £3,500, and the medicines that you need for it will cost between £1,000 and £2,000. So on average, a cycle of egg freezing is going to cost about £5,000, and the initial checkup, like I said, is about £350. The additional costs on top of this would be the ongoing storage costs to keep your eggs safely stored at the clinic, and they're kept in liquid nitrogen and then monitored 24 hours a day, 7 days a week, 365 days a year. The charge for that is £300 per year, and it's for every year that you keep them, and that's for up to 25 eggs in a batch. So just to summarize, essentially the checkup will cost about $350. A round of egg freezing may cost about $5,000, and then you would expect to pay about £300 per year or £25 a month to keep those eggs safely stored. So as I was wrapping up,
Suvir, but sorry to interrupt you. But I know the young girls, when they come to freeze the eggs, it might be difficult for them to find a huge sum like this. And we do have some finance plans, don't we?
yes, so you can, the bulk payment, the large chunk that is required for the treatment itself, the £5,000 or so, we do have credit finance options, so it allows you to spread the cost of that treatment over a year. So the £5,000 could be, spread out over a year, which I think my maths is terrible at the moment, but it's somewhere around £400 per month, essentially over 12 months, and there's no interest or anything. So, if your cash flow is an issue, that's a way that might help you approach the treatment. Okay, so that covers the costs of it. We've done the practical side. So again, I'd like to thank this evening's panel. So I'd like to thank Dr. Venkat for your time and input and expertise on this matter. And Carina, I'd like to thank you for your input, and I'm sure you'll be following up with all of this evening's attendees with any questions that they have. And I'd like to thank all of our attendees. I hope that the session was useful and informative. And then lastly, but not least, I would like to thank Ashley for moderating this meeting and making sure that all our technical stuff works. So thank you all very much. I hope you all have a lovely evening and an excellent weekend. Have a good night.